Hi, everybody. Welcome to Evening Rounds, Volume 3. My name is Sean Cranberry. I'm one of the original organizers of Evening Rounds and its earlier incarnation, HCSMCA Vancouver. Many of you I know, or some of you I know, not many actually, from those early days. We've been doing it for about 2 years, since 2010. How many people here know what HCSMCA is? Okay, about half. So HCSMCA stands for Healthcare Social Media Canada. And it's a tweet up that happens once a week every Wednesday at 10 a.m. our time. And it's really, especially in 2010, a very viral means of introducing the healthcare discussion to social media and the social media discussion to healthcare, especially in Canada. There's also one in Europe, and there's another one run out of Kansas City in the States. So we hopped on that in 2010. We started moderating. We started introducing the Vancouver angle to it. And at some point, we decided that what we were going to do was organize an independent Vancouver chapter to the conversation and really try and demonstrate how awesome the people and the talent is in Vancouver and BC more generally, and lead by example, which is an important thing, as you all know from social media and just the work that you do every day. Lead by example in the national conversation about how great the stuff is that we're doing out here in Vancouver. So tonight is another example of doing that. We're live streaming this to the web right now. You can check out the hashtag #eRounds if you're on Twitter. And make sure that you're either retweeting the stuff that's already gone out that has the live stream link within it so that people can watch this anywhere in the world live right now, which is very exciting. So that's kind of the history of where we got to. This is our third one, and thank you for being here. It's a good crowd. Oh, look, Robin just retweeted me. It's excellent. So let's do some housekeeping before we go much further. We have 3 partners who helped to present this, one of which is W2, which is the building that we're in, the room that we're inhabiting. I'm one of the board members at W2, among the many other hats that I wear. So it's an honor to be a part of this kind of production. We also, our friends from Providence, could not be here tonight, but they wanted to send along their greetings and their regrets. So, talk to them about that next time you see them. I would like to introduce Janelle Chung from Signals, our friends at Signals who built the website and are generally completely awesome. That's Janelle right over there. She's waving. And if you don't know her already, you should. So please introduce yourself if you don't already know her. And Janelle, if you don't know anybody in the room, introduce yourself to everyone. That's your job. Okay? What's that? I know, but she hasn't met them yet. It's a totally different thing, like knowing somebody's face and actually hearing their voice. Right? Julia, you look displeased. Okay, good. So we are, the next evening rounds is going to occur, even though this is a monthly thing, we've been doing it since September. The next one will occur in January. We're taking a break during December because there's far too much going on in everybody's lives, especially since we do this on the 3rd Tuesday of every month, which would have landed at what, on the 18th, right? So yeah, no, everybody is doing Christmas parties or desperately trying to shop at that point. So the presenters in January, just to let you know, are the communications lead Allison Osborne and the project manager Marilyn Bourgeon. Did I get that right? Yes. Victory. All that French I took gave me the proper accent. They have recruited nearly 30,000 healthy British Columbians into a long-term health study called BC Generations Project, sponsored by the Canadian Partnership Against Cancer. Did I get that right? Did you guys change the name? No? Okay, good. And you can find out how they did it, and that will be, again, January 15? Yeah, perfect. And also, everybody has feedback sheets on their chair. Please fill them out. I think, do we have an online link, too? Can we send those to people, too, or are we're all, like, paper right now? We're analog. So, yeah, our social media, analog social media, is happening here tonight. So please fill out the feedback forms. And it's awesome. So without any further ado, I'm going to introduce our speakers and then we're going to get going. Everybody has been here long enough. So Tonight, we have, Sex Just Got Smarter, the evolution of smartsexresource.com, which sounds like something that we've needed for quite some time. The people who are our guests tonight who are going to be speaking are Devon Haag, is the program manager at the BC Centre for Disease Control. She joined the BCCDC, which is very easy to remember, in 2005, working as a surveillance analyst in this STI/HIV Prevention and Control Division, now called Clinical Prevention Services. In 2009, she moved into her current role as the manager of the newly formed BC Online Sexual Health Services Program, an initiative that focuses on using online technologies to decrease barriers to accessing sexual health care, which is pretty awesome. Devon holds a BCSC in biology and an MSc in conservation biology. In her former life, she spent 11 years working as a wildlife biologist in BC. When not chasing down blog posts and wrangling IT technicians, Devon can be found climbing mountains, scaling rock walls, and skiing in the backcountry. So, if you're ever in the backcountry skiing and you see her, say hello. And she will be joined on stage to discuss the website tonight by Lisa Schaffer. Or is it Schaffer? Schaffer, sorry. Is the Director of Client Relations at Creative Bistro, go-to client relations gal and all-around rock star account manager. Lisa is a people person in the first degree. So I'm going to introduce Devon, and please make her feel welcome. Thank you. Ready? Ready for the technology? There you go. Oh, you need to get to the start. Right.
Let's start with that.
Let's start with the first slide, right? Okay, there you go.
Excellent. Is it just
Yep.
down? Okay, great.
There you go. And how's the mic for you?
I don't know. How is it?
People here?
Is that right?
All right.
Oh, okay. Great. Well, thanks, Sean, and thanks to everybody here for having us here today. It's a real honor and it's a pleasure to talk to you tonight about our newly launched website, Smart Sex Resource. And it was actually almost a year ago today when Dr. Mark Gilbert, who is the program lead for online services, actually gave a presentation on the overall program at one of the tweetups. So it's exciting to be here today to tell you that we actually successfully launched one of the programs. So I'll start by just telling you what we're going to be talking about for the next hour or so. I'm going to give a bit of context around why we created a new website, what some of the inputs to that and the impetus for that was, a little bit around the process that we went through, and I'll turn things over to Lisa, who's going to talk a little bit about the Creative Bistro process, because they were the magicians that built the site and made it look as awesome as it does. And she'll also walk everybody through the site and just give some of the key highlights of the functionality. And then we'll wrap things up by telling you a bit about what we've learned through the whole process and what we've got coming up next for Smart Sex Resource. But first, some of you may be wondering, who the heck is BCCDC? So we're actually a provincial public health agency. We have a provincial scope and provincial mandate. So our primary focus is to detect and investigate and research communicable diseases in BC. We're also the provincial reporting center, so we do a lot of disease tracking and trend analysis. And we offer diagnostic services and treatment services for diseases of particular public health importance, of which sexually transmitted infections are a part. So we operate 2 STI clinics in the Vancouver area, and we also support provincial STI and HIV education and sexual health promotion throughout BC. So if we look at internet use in Canada over the last few decades, and this is data that was provided from the World Bank data source, we can see an almost exponential growth in the number of people that have access to the internet. And with over the last the last couple decades, with some of our favorite social media channels coming online, we've actually gone from about 1% of the Canadian population having access to the internet up to over 80% as of 2008. So it's a significant increase. And if we unpack that a little bit further, this is using data from the Canadian Internet Use Survey, which is compiled by Statistics Canada. We look at the red line, which is BC. These are survey respondents that indicate that they have internet access. You can see that we're actually a little bit ahead of the national average, which is the blue line. And as of 2009, 85% of people in British Columbia who responded to the survey had access to the internet. And if you look at the green line, which is the number of people in Canada, internet users, who have actually looked for health information online. So if we kind of hop across the border and look at some U.S. U.S. internet data, this is actually looking at data from the American Pew Internet Project. You can see that, again, a large proportion of people, internet users, have looked for health information online, and at least a quarter of people have also done things like look for drug and treatment information, read about some other people's health experiences, and even track their own health indicators online, like weight and diet and symptoms. So with that, high increase in internet use and also the high volume of adoption of mobile phones and smartphones, we've really entered a new era of STI prevention. And now we can use things like websites and social media tools and social marketing campaigns and online programs to really promote sexual health awareness and education. Virtual support communities are letting people interact and connect in ways that they've never been able to before. And programs like online partner notification and prescriptions and even internet-based testing for STIs and HIV, they really give the power back to people and allow them to take their health into their own hands. So that's where the BC Online Sexual Health Services program comes in. So this program is part of the Clinical Prevention Services service line at the BC Centre for Disease Control, and it was started in 2009 with funding from the Provincial Health Services Authority, with the mandate really to use online and other emerging technologies to deliver and develop innovative sexual health services and interventions to people in BC, with the goal of reducing barriers that people have to accessing sexual health care and ultimately to reduce the burden of STIs and HIV in BC. And we really look at it as kind of a spectrum of health care that we're offering our clients. So we'll have some clients that may only want to access our in-clinic, in-person services, other clients that may really only feel comfortable accessing our online services. And then there's a whole bunch of people in between where they'll be accessing both types of services to varying degrees. So the online services program was initially funded to develop and implement 3 different services. The first of which is InSpot. This is an email-based partner notification program. It's actually owned and operated by a nonprofit organization in San Francisco, and we've customized it for BC. And what this does is it allows people to send e-cards to their partners to let them know that they may have been exposed to an STI and that they should get tested. So we customized that for BC, and we launched just over a year ago in August of last year. The second is called Get Checked Online, and I'm hoping that we'll be back here next year to tell you about the launch of this service. We're actually developing it right now at the BC Centre for Disease Control, and it's really boils down to there's a website that people will be able to go to print and download a laboratory requisition for STI and HIV testing, and then get their results either online or on the phone. So we're hoping to be launching that project in early spring 2013. And then lastly but not leastly, we have Smart Sex Resource. So this is our new interactive sexual health website that we launched just this past August, and what I will be focusing the rest of the presentation on. So now that I've given you a bit of background, I just want to set some context around where we started from. So where we were coming from when we decided to create a new website. So we have, or had until Smart Sex launched, a website called stdresource.com. So this was developed back in 2000, actually year 2000, by the STI and HIV program at the CDC. And it was really mostly a static information site with quite a strong kind of medical, clinical focus on STIs. And it also was a bit of a case of, if we build it, they will come, and then we don't really have to do anything to it anymore. So after about a decade, the site had become a little outdated, both in the look and feel and the functionality, and definitely in the content. But as outdated as it was, people still came to it, and a lot of people came to it. We continued to have a high volume of traffic, including a high proportion of people coming to the site from the health authorities and from other health organizations. So it was a valuable resource to healthcare providers. And then when we looked at traffic to our other site, the main BC-CDC site, we saw that STIs and HIV were really among the top searches on that site. So we knew that people were seeking information on sexual health, and not just specifics about STIs, but more broader information like what to do in a new relationship, what kinds of testing you should get done, and how to talk to your partner about sex and talk to them about testing. But of course, we also know that talking about STIs and sexual health in general is a really difficult thing for some people. For decades, I can't imagine why, but sex and health has really been stigmatized. So, and even now, it's a really difficult topic for people to discuss, and it really raises a lot of anxiety in people. So, one way to help destigmatize and even normalize sex and health is to provide a safe, non-judgmental, and sex-positive environment in which people can have an open dialogue. So that's what a small group of nurses at the CDC have been doing for a number of years. We like to call them our cyber outreach team, and this is a group of nurses that are active on a number of other sites, giving health information and answering people's questions. And the cyber outreach team has actually been around since 2003, and it was created in response to a growing number of people that were looking online for sex partners and also for sexual health information. So the nurses have been active on a number of sites over the years. Just to give you an idea of a few of them. So Squirt is a gay cruising site, and they have a health nurse profile on that site, and they're available through chat and also through email to answer questions. They're also on the Pacific Escort Review Board site, so this is a site that is primarily for sex workers and their patrons to talk about different things, and the nurses operate a health information forum on that site. And then they're also on Nexopia, which is a youth-based site. They operate a sex health information forum there as well. So it's a lot of work and a lot of effort that the nurses put in. Has there been any impacts? Does this actually influence people? And we found out that absolutely it does. We conducted a recent survey on PERB of sex workers and their patrons, and to see how their what their level of acceptability of the service was. And interesting, we found out that only 36% of people surveyed actually had a health provider that they felt comfortable talking about their sexual health with. Almost 100% of people found that the service was important and that it was useful. Over 90% of people reported that the service and the knowledge that they gained helped influence their own sexual health knowledge. And over a third of people said that it actually impacted their own sexual behaviors. And just at the bottom is a quote from one of the survey respondents, and we really like this because it's quite a meaningful statement. The information and follow-on readings provided are like lighthouses that guide us through the sea of treacherous information out there. So it really indicates to us that this service is actually reaching people. So that brings us to Smart Sex Resource. So when we sat down in, I guess it was early 2010, we thought, okay, we know that we have to create a site, and we know we want to replace STD Resource, but what? What are we going to replace it with? What's our vision? So we came up with our vision, which is to create a comprehensive sexual health site for British Columbians that really provides local and relevant sexual health education and promotion with an emphasis on local. Provides access to sexual health nurses, so we really wanted to draw on the experience and the skills of our cyber outreach team and offer that as a service on our own site. Given the traffic of healthcare workers to STD resource, we wanted to continue to provide that resource to healthcare providers and agencies working in sexual health, and also be able to expand and enhance on that. And we also didn't kind of want to fall prey to the static website. So we wanted to create something that was really engaging and use dynamic content and new technology and ongoing evaluation to keep people coming back. So how did we get from there to here? Well, if anyone works in healthcare, you'll know that there's often a lot of delays and things get off to a slow start. And sometimes you run into some minor detours along the way and some other challenges and barriers that you need to work your way through. But we eventually got there. So this is a bit about how we did it. First thing that we did was create a working group. Everybody loves working groups. And this was a phenomenal group of people that we brought together. So we had epidemiologists and educators and a couple of the cyber outreach nurses and also the web manager for Immunize BC and the BC CDC website. And this working group was really instrumental in informing the whole process from start to finish and actually continuing to inform because they've now become our operations team now that we're in operations mode. Second thing we did was look at partnerships that we could establish. So we looked both internally and externally, and we had a tremendous amount of collaboration and input from a lot of different people. On the internal side, we had our working groups, not just the Smart Sex working group, but also a clinical integration group, which really helped to advise us on the content and the process. We drew on a lot of subject matter experts to develop our content. We worked closely with PHSA Communications for our communication strategy, and even more closely with our privacy and our risk folks and legal services to make sure that we were really meeting all of their requirements. And then we looked externally. We partnered with researchers at UBC, and I'll tell you a bit about that. We worked with some great consultants, Creative Bistro, of course, being one of them. We formed a community consultation working group with a number of people from different community organizations, and they really helped to give us that community perspective. We worked with health authorities and other public health people to give us the public health perspective. And then, of course, we involved end users in the usability testing. The third thing that we did was look at what we actually had. So take stock of our internal resources. So we looked at traffic to STD resource, where people were coming from, what pages they were going to, frequently viewed pages, frequently entered search terms. We also looked at questions that people had submitted through the Contact Us form to give us a sense of the types of information that people were looking for and also the level of detail that people wanted that information at. We also conducted a user survey, 4-month user survey on STD resource to really start to look at why people were coming to the site, were they able to find the information that they were looking for, and if not, what was that information, and what types of services would they be interested in using in the future, so things like podcasts and video, chat with a nurse, and things like that. And then we looked outside, so what is actually out there right now, and what do we like about it, and what do we not like? So we started with quite a comprehensive list of sexual health websites, mostly with a North American focus, but also a few European sites. And we did a fairly detailed analysis, so we looked at the types of content that they offered, how it was structured, different interactive features that were offered on the sites. And this is actually a word cloud that was created with the top-level navigation topics from all the different sites. So we really got a sense of what we liked and what we didn't like, and some kind of do's and don'ts for our own site. So then we took all of that information and knowledge, and we started brainstorming. So we worked with a company called Social Signal. It's a Vancouver company, and they worked with us to bring together about 28 people for a full day of brainstorming. So we had people from the CDC, clinicians and educators. We had people from public health and also from our community partners. And we spent a full day really thinking about what we want the site to be and how do we want it to function and what types of features do we want to have. So then Social Signal took that information and developed a website strategy for us. And they really focused on 4 main areas. So they looked at options for supporting discussion, so how we can engage people and really encourage that online dialogue. Options for sharing information, so what kind of content do we want to have, how do we want to generate that, and what are the different ways that we can share that with people. How can we continue to be a resource for healthcare providers and community partners, and what are some different options for that? And then also outreach and dissemination. So how can we use social media to really raise awareness and drive traffic to our site? At the same time, we partnered with Dr. Jeannie Schaffer at the Jeannie Schaffer and her youth sexual health team at the UBC School of Population and Public Health. We worked with them on a CIHR-funded study to look at the perspectives of youth towards online sexual health services, and then also at how social context could influence perceptions to and engagement with online services. So Jeannie's team used a number of methods like focus groups and interviews and our youth roundtable to really kind of get at how youth evaluate and review different online services. And one thing that we found, which some really valuable knowledge that we gleaned from the research, was what youth really want in a sexual health website. Some of it wasn't all that surprising, but some of it actually was interesting and surprising. So youth really wanted practical information and accurate and reliable information. They wanted to see some peer-generated content and also have easy access to that information, especially if they're in kind of a heightened sense of anxiety, crisis mode. They really wanted to see a professional website, so professional approaches to design and to content and images. They really valued value neutral and gender neutral language. They actually didn't really want colloquial or slang. They actually found that that would be potentially offensive. And then they really placed a lot of value on the credibility of the site, and they really wanted to see that that site was affiliated with an organization. So we then took all of that and started on the website development. So if anybody has actually worked on a website, probably most of these steps aren't anything new to you. We went through wireframing and a great branding process with Creative Bistro, our requirements, some design and layout, lots of content development. We actually wrote all new content on the site, so there was many rounds of editing. We did some usability testing. We did a clinic photo shoot, which Lisa will also tell you a bit about. And then we really worked closely with Bistro on the build and training and testing and finally launch. And I think everybody was really meetinged out by the end of the process. And just when we thought that we were done, we weren't. We had to do a lot of work around privacy, so we had to do a privacy impact assessment, which was really valuable process to go through. We looked at the types of risks that could be posed by the site for the collection, use, and disclosure of personal information. And then we looked at how we could mitigate that. So we actually incorporated some of those suggestions into the build of the site. Everybody in healthcare loves our policies and procedures. We have to have one for everything. So we wrote our own privacy policy in terms of use, because the standing PHSA one just wasn't specific enough. We developed procedures and guidelines for online outreach and nursing and also operations, social media, blog guidelines, a style guide, ways to handle complaints and ensure quality. And we worked really closely with our risk management people and legal services and also professional practice to make sure that we met all of their standards. And finally, evaluation. So planning for the evaluation before the launch and then executing that evaluation after. So it's a bit of a complicated slide. I'm not going to go into much detail, but just to say that this was actually a logic model that was developed by Travis Hoddes, who is in the audience over there. And he really took our working group together through this exercise where we looked at the different core components of the website and the outputs from those components, and then at the short and long-term outcomes of that. So from that, he was able to develop an analysis plan, which for the next while is really focused on looking at the website metrics and also conducting some user surveys, which we will be doing in the next few months. And so now I'm going to turn over to the lovely Miss Lisa, and she will walk you through the site.
Thank you, Devon. I'm shorter than her. Great. So first of all, I want to just talk a little bit about Bistro, who we are. We are an interactive marketing agency. We work on branding as well as web and app development. And we were absolutely thrilled to be invited to partner with this project. We're big fans of meeting people with where they already live. So building technology and websites that meet the needs that we know people have right now. We know people living on social sites. We know the kind of voice and tone they want. So to be able to bring that to the online sexual health group was a great opportunity for us. So we have strategists, we have web developers, we have designers, we have project managers like myself. And we got all together in a room when we found out about this project, and we thought, how can we do this? How should we approach this? And we thought, let's treat Smart Sex Resource like a condom. We wanted to have form. We wanted to be sexy. We wanted to have function. We wanted to work. And we wanted to have follow-through. We wanted to do what it says it's going to do. So that's kind of how we approached the process. And when we talked about form, we talked about design, you saw in Devon's slides what the former website looked like. And we really wanted to bring a more lifestyle approach to it, really open it up, make it bright, and you'll see that when I go through the site with you. And we know, like a condom, we all haven't probably thought how many iterations of a condom have there been. And much like that, there's been many iterations of the website, many iterations of the branding, and to get us where we are today, which we think is a really sweet spot. Function-wise, we wanted it to be appealing to people. We didn't want it to be scary. We've all been in that moment where you just need to find one, and you need it to work. And we wanted the website to have that as well. And also to not judge, to not care what your gender is, what your age is, what you're going to do with it, just that it's there for you and doing what it needs to do for you. So that's really the sensibility that we approached the project with, and I think it served us well. So I'll take you through the site now. This is a screenshot of the homepage, and one of the things that we learned, as you saw, Devon and her working group did an amazing amount of pre-work that really informed us really well what we needed to create. So we wanted to create a landing site that gave you multiple entry points. So whether I'm here and I'm in a crisis mode, and I just want to find information quickly, if I'm more of a I just want to know my specific thing and not worry about your thing type person, we're going to give you the A to Z area. If I just want to get to a clinic, I want to be able to find that really quickly. And if I want to talk to somebody because I'm feeling like I have a question and no one else on earth has ever had this moment, we wanted to provide an opportunity to have an online chat with a nurse feature. So you'll see that all reflected on the homepage. There's lots of entry points. We wanted to make it bright. We wanted to make it like a magazine type feel, welcoming and engaging for people. So right off the top, there's lots of entry points, places you can see where you can engage in the site. So from there, I'll take you down the right-hand column. And like I said, we have the what to do ifs. We wanted quick links because we learned from talking to the youth and we learned from all of our experiences that sometimes when you're in that moment and you think, again, no one else has ever had this moment, I just want to know the answer to this exact situation, give really quick links off the top. So that's what the what to do if section is. I'll also talk a bit about functionality near the end and as well throughout the slides. This is built in Drupal as an open source CMS. I'll actually point out, Kevin Chan, my VP of Technology, is here in the room, so he was actually the magician that made it come to life, along with Sarah Bennett, who's our senior designer, who made it look so pretty. So we wanted to provide that. This is going to flex and change as situations arise, as we watch the analytics of the site, as we see what people are talking about. This area can grow and change with it. Then we wanted to have the chat with a nurse. I want to talk to somebody right now. So this was an area of development for us that was pretty unique. We needed to find a secure, compliant with the privacy regulations, Canadian-based chat server that would allow for one-on-one discussions between a nurse and an end user in a really secure way where people would feel like they could trust it. And so we developed this system. It's an area that we definitely want to evolve and kind of grow. But right now we have those outreach nurses work, and they are able to be online, and people can get a hold and just ask their immediate questions right in the moment. And that, again, is right off the top on the homepage. And then the A to Z topics. It's a bit like a glossary, for lack of a better word. This was an amazing exercise in thoroughness. The word I'll use, coming up with the terms, the definitions, and working with the back end of Drupal to make sure that the tags and keywords all lined up so that people could get the right information the quickest way possible and in the tone and voice that we wanted them to receive that information in. Then going across the top, navigation, about STIs. This is the area where the online sexual health group really wanted to be able to put statistical information, which is why everyone goes to a sex website, for the statistical information. So we were a bit challenged as their partner in this point to try and find interesting ways to present that information. So far we've got some infographics, and we've also got a chart there that we think is quite sexy. Because as Devon pointed out, people wanted to get all of the information in one place. So as much as comparison is the thief of joy, we do want to see, if I don't have this, do I have that? And what does that mean? And what is itchy? And how does that work all together? So the charts allow for that. And we, again, see this as an area of opportunity for us to be able to grow and flex with the website, come up with new and interesting infographics, and keep it really fresh looking. Then we have the Get Tested area across the top. This is where the group wanted to talk about not just, hey, here, how do I find a clinic, but also what to expect. It's a huge part of why we love this website is that it's very human. It creates human connections in a kind of static environment, or what could be a cold and static environment. So to this end, Devon and I spent a lot of time talking about how we can achieve this visually. And with the help of Sarah and a fabulous photographer, we actually did a clinic photo shoot in an actual clinic. And we used community-based models. We had people volunteer to come out and join us. So we really are pleased in the outcome. We have some great photos across the website of things that you might actually see if you go out to this clinic and need to have this experience yourself. So there's huge value in doing that. And again, an opportunity to grow and keep going with the website. It also gives a really trusted vibe, you know, familiar faces, genuine people. These aren't static, model-y shots. It worked out very well for us. And then further to that, we wanted to create a clinic finder that was a little bit more than what you're used to finding in a clinic finder. So we also know that not everybody works Monday to Friday, 9 to 5. And sometimes you need to find a clinic that's going to be open for you on a Saturday or Sunday or after 6 p.m. So the CDC had an amazing database of information that would allow people to search in these different ways. And building this in Drupal allowed us to create that kind of search quality so that people can find what they need in multiple ways. And then we were so pleased with the outcome that part of our opportunity is we created a clinic finding widget. So there's actually a piece of code on the site in this part of the website, rather. So other people can use this as a resource. So if you're a smaller, we wanted to represent all across BC. If you're a smaller clinic or you're more rural, your clinics are still included in this, and you can just put this right on your website where people can copy it and bring it over. So I think that's a huge testament to what was built as well. It's meant to be shared. And then across the top, we also have Sex Talk. This area of the website, the CDC really wanted to create an area that was slightly less clinical and maybe less statistical. So this is where, again, we're very excited to grow into this with the online sexual health group. We see this as an area where we can bring in some polls and some quizzes, some genuine interactions that are a little bit more on the fun side of having sex, because sex is meant to be a little bit fun as well. So we're very proud of this area we made. You can laugh at me, Sean, but it's true. So this has a lot of great thought-provoking images. It has some good conversation starters. It's kind of, I don't even know how to begin this conversation with my partner area. So the real, again, more human aspects of what it is to be sexually active and not make it like Degrassi Junior High and we don't really talk about these things. And then we come to probably the most interactive and hardest to wrap our head around section of the website off the top. And that was the Ask Us section, which can seem simple enough, but we really wanted to create an environment, again, that was secure, that was trustworthy, that would really engage people and encourage them to post a comment, ask their question. They can ask it privately or publicly. People can leave a comment. How do we avoid spammers? We want people to rate these comments and questions to get what we want out of the analytics, but is that opening a scary door? And that was a lot of conversations that were those many, many meetings that Devon mentioned as well. But we're really proud of how this has come out. So it really walks people through the process of getting your question asked. And one of the great features that we used is in the back end of Drupal is the solar search. So when I post my question, if someone else has answered a very similar question, it will right off the top say, do any of these answer your question? Not in an alienating way, not in a like, get a new idea, but just, do these meet your need? So that's going to be off the top. And then even if you see something similar, but you really want your personal question stated, you can still position that forward, and you can choose to do so publicly or privately. And all of these are moderated by those outreach healthcare nurses on the back end. Everything is very trusted resource-wise. Things go through and come through in the Ask Us section in the top 10 questions, which again is going to be another dynamic quality of the website. When you think back to that previous site that we had, how the information was stagnant for almost a decade, these top 10 questions can evolve and change within a month or within a week, depending on how active the site is going to be. So it's pretty exciting and gives everybody a reason to come back. And then, as Devon mentioned, we knew that a lot of people were coming to the site through healthcare providers. So we wanted to create an area that was set up for them and set up in a really clean, direct manner, easy for them to use, so that if I am in a clinic in Prince George and I want to find a resource that I think is going to be up to date, I know where to go. And again, Drupal is allowing us to, the taxonomy in the back end, we're able to support multiple languages for resources for people to download in PDFs really quickly here. You can sign up for an RSS feed. So a lot of what's going on in the web right now is also, we want to create content on our site. We want to give people a reason to come and visit us versus the old method of just sign up for my thing and I'll send it out to you. So it's got a really good balance of the two. We're going to have rich content on the site, but if you need us to come to you, we'll give you multiple ways to do that. So we have our RSS feed and an email sign up for the new blog, which replaced the previous e-newsletter that they sent out called Shake. Do you want me to do the thing again? I can do it. Okay, can I do it? STIs, HIV, AIDS, knowledge exchange. Yeah, that's right. So now we have STI updates instead. So those are what people are going to sign up for. A little bit sexier, hey? So again, this is going to create dynamic content. The event calendar rotates through, so we can set it up to do anything, but right now I think we have 3 events. 5 events showing. But those could be anything from across the province. So again, to engage the healthcare practitioners and people involved in the industry, they can submit events that could be put up and shared on the website. So this is just a shout out to Drupal. Our CMS that we built the website in, we love it. It was great to use for our developers, and all signs point to it being very positive for the end users as well, which was great for us. And Devon mentioned in the UAT testing that we did it by roles. So we actually have really high-level administrators, then we have moderators, so those people that are going on answering the questions, moderating the comments, doing those things, and then the analysts, such as Travis, get to go in there as well. And we are able to set up the back end to allow different views for different users. Very flexible, very adaptable. A lot of the site that you see on the front is kind of modular. So if we want to pull something off the front homepage, we can do that. If we want to promote something, we can bring it in. So it has a lot of room to flex and grow and evolve. So we really see this kind of living and thriving with these guys. And so that's my form, that's my function, and now we're going to talk about follow-through.
Thank you. And just actually to add to what Lisa was saying about kind of the dynamic aspects of using Drupal, are you trying to tell me to speak up a little bit? Yes. Actually, I had an interesting conversation with a couple of our outreach nurses the other day, and they said that with all the questions that have been coming into the site from people, they had to do a lot of research, and they found out some new things, and they were actually able to go and update the content in other parts of the site right away, whereas they weren't able to do that at all before. So that's been a really valuable thing to have. So now that we have been out and about for 2.5 months, how are we doing? So if we look at some of the metrics that Travis kindly pulled for me, in the last 2.5 months, we've had over 13,000 visits to the site, more than 10,000 unique visits. We've also had over 50,000 page views, which I don't have a lot of context for comparison, but it seems great considering that we really haven't been doing a lot of promotion. We've really just been focusing our promotion on healthcare providers and on clinics and to our community partners. In the first 2.5 months, we've had 50 questions submitted, so it's an interesting equal divide between people that wanted their questions posted publicly and people that wanted a private email response. We've got 38 subscribers to the blog and more each day, I think. The chats have been a little slow to take off. This is actually also something that was experienced with Immunize BC, and I think that really just speaks to the need to promote the site and really get the word out there that the private one-on-one chat is available. Another interesting thing that we've noticed is that actually a third of the people coming to our site are doing so from mobile phones. It's a bit higher than I'd anticipated, so again, this really kind of points to where we need to focus our efforts to, in future enhancements to the site and really start to make it mobile friendly. So when we look at the engagement of the audience, so we saw a fairly high increase in the number of unique visits to the site in the first month, which isn't really surprising. We've also seen a gradual increase in the number of return visits to the site, also not surprising. But when we look at the length of the visits, that's where things get really cool. When you look at the average length of all the visits, people are actually staying on the site for almost 4 minutes. And then when you look at the average length of return visits, it's almost twice that length. So people are coming back to the site and they're using it in the way that we want them to use it.
That's huge.
We've also built in some functionality to allow people to rate the content pages, and Lisa had mentioned too that they can also rate questions and answers. So it might be a little bit hard to see, but on the bottom of each static content page, there's a question, was this page helpful? And people can answer yes or no. So I was a bit skeptical when we added this functionality because I never rate pages on websites, and I didn't really think anybody else would. But people have actually rated over 800 times, and 76% of people have said that the content is helpful. And when we look at kind of the top areas that people have rated, sex concerns, which is under the sex talk section, types of STIs, which goes into detail about each type of STI, and then also the what to expect section. So it's been an interesting process that we've gone through. There's been some definite highs and some lows. Focusing on the highs first, I think with all the people that we've been working with, everyone gets it. There was tons of support for the site, and people really kind of felt some ownership because they were making something useful. We actually had an impact and continue to have an impact. Another high has been the great collaborative and supportive teamwork that we've had, and further to that, the partnerships that we've formed with research and other program areas. Just anecdotally, we've had some really positive feedback from health providers. Our education team has actually been kind of highlighting the site and different courses that they've been giving to public health nurses around the province, and we've had some good feedback. and definitely pushing the boundaries, because sometimes the boundaries can be pushed, and it's a rewarding experience. So on the other side, there's some lows. I think one of the main challenges that we faced was institutional. So things like delays and different hurdles and levels of approval that we had to go through that we really had no control over. And you wanted to...
Let me talk to this one. So for us, partnering with the CDC was really interesting, and it was a huge learning opportunity for us. We learned a lot about the privacy concerns. That's what I considered one of the most institutional challenges. That and the love of IE7, you people. Bless your cotton socks, but we need to get out of IE7. But the institutional challenges of the privacy piece was really huge for us, and learning how to navigate some of the challenges and changes. We had the opportunity to work, to bid and work with some other projects at the CDC, and I have to say, cutting our teeth on smart sex was a huge bonus for us, actually, in the end, but at the time, slightly exhausting. Building it in Drupal was also the right solution for sure. As one of my developers pointed out to me today, the whitehouse.org or .gov is actually built in Drupal as well, and they probably have slightly more restrictive privacy concerns than even the CDC. So that was my big one.
So another thing that we encountered and continue to encounter as resource constraints. So money and people and time. Everyone has a really high workload, and trying to carve off time for writing a blog post or a news and events post or other content for the site has been challenging. One thing that we don't have the capacity to do right now is we don't have a Facebook page, and we don't have a Twitter account, because we just don't have the manpower to staff that, and we really want to do it properly and not poorly. So another one is stigma, and this is really kind of an internal stigma, an organizational stigma against the topic of sex and sexual health online. And there was some political and organizational sensitivities around that really meant we couldn't do some of the things that we wanted to do, which is a good segue to the last one, pushing boundaries, because sometimes the boundaries push back, and that can also be a little frustrating. But we've learned a lot of lessons through this process. One thing we learned, it's not the year 2000 anymore. You can't just build a site and hope that it is going to stay current. You have to put a lot of work into the infrastructure and resources to support that online engagement. You certainly can't please everyone. It's not a really new lesson, but certainly was kind of reaffirmed through this process. Things definitely take a lot longer than you think that they're going to, and partly because there's a lot of things that are out of your control. But ultimately, persistence definitely pays off. And it really came down to, when I started the project, I thought, it's just a website. But it's so much more than that. And ultimately, really, our purpose is to give control to people over their own health care. But that also means us as a healthcare organization giving up that control, which is a bit of a shift, and we have to start instead focusing on how to mitigate those risks. So just to wrap things up, what's next? Definitely social media channels. We need to do Facebook. We need to tweet. We're really interested in looking at developing our own partner notification service, so like InSpot, but also building in text capacity. We have a platform that is currently being developed at the CDC as part of the mobile health program to send out text reminders right now for vaccinations, but we'd like to incorporate that to SmartSex and send out it's time to get tested reminders. And I'd also really like to do a needs assessment of healthcare providers to see how we can enhance that health provider section and really provide resources that providers can utilize. And of course, promote and promote and promote. We need to get the word out there.
And our wish list from the development and partnership side is to see SmartSex move into responsive design. So I don't know how many people are familiar with responsive design. Of course you are, Sean. It's amazing, and it allows you to maintain one database, but be seen and experienced. What is it? Agnostically, device agnostic. That's the word I'm looking for. So you can experience the site the same way on desktop, tablet, or mobile phone, but only maintain one site. So it's a place we really want to see this go to. There's a couple roadblocks to that right now. Our chat program that we're using does use Flash, but we built in Drupal, and Drupal being open source is also to our advantage because Drupal core is working on their own chat module that looks like it's just about stable, so we're probably going to be able to evolve into that sooner than later, which is only going to help us when we take you guys to responsive.
And that is about it. Just wanted to say a big shout out to all of the people that helped with the site and the content and the process and the look and feel and all the good stuff. And thanks, everyone. I can't really speak to other public health organizations. I know within the STI and HIV area, to build STD resource, they had worked with another kind of external company. But certainly in my time there, that this was the first time that we had worked with a marketing company, and I thought the experience was great because they weren't constrained by the institutional constraints that we were. So they really kind of brought this energy and life and hate using the word, but out of the box thinking that really kind of allowed us to push those boundaries.
Yeah, we definitely we showed up without a lid on our box, and we encouraged them to go with us on this journey as far as humanly possible. For us, this was our first experience working with a government agency that I can think of. That being said, it did come. The contact came through our work with the Health Initiative for Men. So the HIM group on Davie Street, we've done some work with them. We worked them on the Hottest at the Start campaign, and as well as What's Your Number, which is a HIV testing reminder service. Yeah. And it is a very different experience.
Would you do it again?
Totally.
So the question is around, will we look at providing resources and supports for seniors and sexual health in the future? And that's a really good question, and that's actually has been raised before, because we tried to be kind of age neutral on the site, but it is a different kind of population and a different conversation. So that is one thing that we have been talking about, how we can incorporate that, and whether that's an A to Z topic or some blog posts or some different types of, I'm not sure yet, but that is, thanks for raising that, because that is an area that we'd like to delve into.
Visually, again, that photo shoot that we did, there was a good cross-section of age demographic in those photos, and as well as in the sex talk area, the groundwork is definitely there to continue the conversation. And I think even one of the header images is of an older couple on a scooter being awesome. So. Like you do.
a really good question, and we don't know. So the question was when we were looking at traffic for our STD resource, and there was a few plummets to zero. Yeah. Yeah, I tried to find out what that corresponded to, and because I think it obviously there was something happened. I don't know if the metrics software crashed or the data was corrupted or something, but I haven't been able to find out what caused that. But good catch.
And that was going back to my institutional constraints. We weren't able to use Google Analytics, which is kind of everyone's go-to now for websites. So we're actually using Piwik, which has actually got a really interesting dashboard and interface. So it'll be interesting to see as we head into the new year what kind of traffic we see on the new site.
So the nurses that are working to answer the questions, they've actually been part of that team for a long time, so they've got quite a bit of experience, but they definitely do kind of cross-validate. So I know that, say, Elaine will write an answer, and they put a tremendous amount of research into, because if there's some things that like, oh, I've actually never really heard of that before, so let me look into it. So then they'll collect all the information and write up, and then get the other nurses to kind of validate that response. Yeah.
Can I add just one thing? It seems weird for me to speak to this, but it's one thing that I learned in creating some of the processes as well is that these nurses actually do charting at the end of their shifts as well. So just like you would go ask a nurse in a clinic who has to chart the responses, these guys have to chart as well. So we had to come up with the chat solutions and things like that made it really easy for them to engage in the moment and then recollect that information at the end. So, for example, they can download the chat logs for the day and use that to help their charting process.
Yeah, and actually, I'll just a little bit further to that. We created a whole database to support that charting process. So every question that they answer and every chat that they engage in is recorded in that database. And that's not just for kind of our evaluation, but it's also part of professional practice. So right now, the only real opportunities for that content is in that Ask Us section. So people write in their questions, and then people can also comment on questions and on answers. And so actually to date, we haven't really had any comments. We've had one comment, but it was more the same person asking another question. But that was part of, we were kind of surprised that we got away with that. But that's part of also like some of the steps that we built in to kind of protect that process was everyone, if you want to leave a comment, you have to have an account. And so you have to give your email address, and if you're abusing that privilege, then we can block it and block your email address. And we've got a whole raft of community guidelines in our terms of use. And the comments are all moderated too. So the nurses have the ability to either correct them or pull them if they're inappropriate.
And that would be a huge test, right? If you start getting comments and stuff starts going viral, then that's when you know you've really succeeded.
Yeah, I would agree. So come to the site and leave comments.
Thank you, everybody, for coming. Again, we're going to skip December altogether so that everybody can enjoy shopping and visiting their friends and family. And we will be back in January. Thank you for coming to Evening Rounds, Volume 3. Thank you to our presenters. And since this is a networking event, we encourage everybody to stick around and meet people that they don't already know and introduce yourself and yeah, have a good time. Thanks for coming. See you later.